everybody and welcome back to my channel. This is Dr. Mridula V. Amarnath here. So how is your journey of pregnancy going so far? Well, probably if you're in your third trimester, you might be having this query. You don't have diabetes, you've never had diabetes in your pre-pregnancy state. None of probably your parents, they also don't have any diabetes. So is it really important to check for diabetes right now? To check for your sugar levels right now? Well, to know more, stay tuned. Well, I must say it is important to check for your diabetes because while you're pregnant, there are certain hormonal changes and some of them can get a special type of diabetes, what we call as gestational diabetes. That is the diabetes that happens, once you are pregnant.
So in all pregnancies, a specific hormone called the human placental lactogen continues to increase as the pregnancy progresses. Now, most pregnancies handle this change without difficulty. However, in some circumstances, this particular rising hormone changes the body's metabolism of sugar and insulin, resulting in gestational diabetes.
So generally, you would notice this gestational diabetes somewhere at the beginning of the third trimester. And hence, I would recommend that it is absolutely important that you get yourself tested because it can have, now this abnormality in the sugar and insulin metabolism can have an impact on the mother as well as on the fetus.
Some of the most common issues that are seen are urinary tract infections, fetal growth problems, probably the baby could be either too big or too small, high blood pressure, preeclampsia, excessive amniotic fluid that can actually cause a premature delivery, increased chance of the C-section, damage to the shoulder and arms during the delivery if the baby is large, certain birth defects, fetal death, and sometimes even respiratory distress for the baby after birth.
It is actually quite difficult to make out which set of women would develop gestational diabetes because there is no particular pattern that these set of women, if they have these factors, they will definitely develop gestational diabetes and these set of women will definitely not develop. It is absolutely not that way. And hence it is mandatory that you get yourself tested. But there are certain risk factors. There are certain set of women who we know are at a higher chance of developing gestational diabetes, such as
those women who are obese, who have a high blood pressure, over the age of 35, or even have a strong family history.
Well, the next question is, don't you want to know how do we test for gestational diabetes?
The testing for gestational diabetes is usually done at about 26 to 28 weeks. So you will be asked to drink a sweet beverage that is given to you by your health provider. So 1 hour later, your blood will be drawn and checked for glucose level. Now, if the level is low or normal, then no more tests are necessary because you do not have any gestational diabetes. But if your glucose level is high, you will be asked to do another couple of tests. The follow-up test would require you to fast for 12 hours, which means you do not eat or drink for 12 hours prior to taking the test. The first blood drawn will be taken immediately after fasting. After that, you will be asked to drink a larger volume of the same laboratory sugar beverage. For the next 3 hours, your blood will be drawn every hour to check your glucose level over the time. Now, in case if these levels are still high, then you may be diagnosed with gestational diabetes.
So now once if you're confirmed to have gestational diabetes, then you would be asked to start or alter your diet. So now this diet would be according to the American Diabetes Association. So they have a prescribed diet. So you will be asked to follow that. So generally I've seen for most of the patients with simple diet modifications, they're able to control their sugar. So they ask you to check by yourself at home. And even apart from that, even your doctor would closely monitor you. But for some of them, even after all these diet modifications, if the sugar levels are still onto the higher side, then they would be immediately started on insulin injections. Now, if you have diabetes, then you're actually put in the high risk category. So certainly you will have more prenatal visits. Your doctor would want to monitor you more closely. probably the number of ultrasounds that would be done on you would also be more, because it is important to monitor the growth and the development of the fetus. So I'm not going to scare you, but then I'll just make it very clear. In case if you strictly monitor your diet and monitor your sugar levels, you can have an absolutely normal delivery. You can have a normal labor, normal vaginal delivery, and a normal and a healthy baby. But at the time of labor, while you're in labor, your sugar levels would be frequently examined and checked for. And even after delivery, the baby as well as the mother would be frequently thoroughly examined for over a period of 24 hours before they are being shifted. So some women are concerned. They come and ask me, Doctor, now since I've got gestational diabetes, do I have to continue my insulin medications and everything even after my delivery? Well, that's not true. Once your delivery is done, once your baby is out, majority of the women, they get back to normal and the sugar levels are absolutely normal. So you don't have to worry, you do not have to continue your medications and all those things. But there's another part to it. These women are probably at a higher risk of developing the normal adult onset diabetes at a later stage in their life. So I would say do not completely ignore it. Make sure you get your sugar levels checked probably every once in 6 months or once in a year. Probably as you're at a higher risk of getting these adult onset diabetes. But the take-home message over here is make sure you get your sugar levels checked, especially in your 3rd trimester, because that's the time when gestational diabetes will begin. After that, in case if you have diabetes, gestational diabetes, make sure you strictly control your diet. Follow the strict diet pattern as advised to you. If you have to take injections, make sure you take injections and medications. Make sure your sugar level is completely under control. Okay? So stay safe and stay happy. Bye-bye.